What's up? What up, yo? See if that works. Yay. What's up, H-Town? So today's gonna be fun. I am gonna be going live with one of my colleagues who, a doctor, to talk about the COVID-19 vaccine. Want to get them on here really soon. But before they're actually able to join, I'll give a quick introduction and a little bit of background. So, about a month ago, I did an Instagram live regarding the COVID-19 vaccine. That live was with Dr. Sarah Henn, who's a chief medical officer at Whitman-Walker. At that time in America, the coronavirus had infected about 13 million people and killed over 275,000. And at that time, no one had been vaccinated. So now in America, the coronavirus has infected over 22 million and killed over 375,000. And just over 7 million people to date have received the vaccine. So clearly the pandemic is worsening, and only around 2% of Americans have actually received the vaccine. So people have questions, and we want to be here to answer those questions. So I'm going to get Dr. Henn on this live right now. And she'll be joining. So Dr. Henn joining me tonight. Again, we'll answer. Hi, Dr. Henn. How are you?
Hi, how are you? Good to see you again.
I'm doing good. So Dr. Henn is going to answer questions from our viewers about the COVID-19 vaccine, the vaccine campaign. Again, Dr. Henn is the Chief Medical Officer at Whitman-Walker, where she has worked since 2007. She is a board-certified physician in both infectious disease as well as internal medicine. She also holds a Master of Public Health. So welcome again, Dr. Henn. It's nice to see you.
Good to see you too.
Would you like to introduce yourself?
I think you did an excellent job. I'm happy to be back here and getting a chance to talk again about the vaccine. I think it's so important that people get their questions answered, and I'm excited to have the discussion tonight.
Yeah, absolutely. So I want to remind everybody, if you are tuning in and you have questions about the vaccine campaign, how we're going to introduce the vaccine to the community, feel free to drop a comment here and we'll do our best to answer that question. But just for your awareness, I am David Wilson. I work with Whitman-Walker in our community health department. And so what we're doing here is providing information via the social media platform as Instagram, Twitter, Facebook, about different social and public health issues. So today we have Dr. Henn again. My pronouns are he, him, his. And we're going to do basically a Q&A with Dr. Henn. All right, so first question I have for you, Dr. Henn, is, and excuse the sirens in the background.
It's okay.
A number of viewers are worried about the safety of
So
a number of viewers are worried about the safety of the vaccine. And, you know, they're also worried about the data that is available for HIV positive folk. You know, is it safe for HIV positive folk to actually take the vaccine? Should people who are HIV positive get the vaccine?
Yeah, so we're absolutely encouraging people who are HIV positive to get the vaccine when it becomes available. So, you know, the safety data on both vaccines, so there's two that are currently available in the United States, the Pfizer vaccine and the Moderna vaccine. And the safety data for both of them was really excellent. These vaccines were really well tolerated. Most people reported, you know, some pain at the injection site, maybe some fatigue, maybe some muscle aches, but really tolerated the vaccine very well, kind of what you would expect as a typical vaccine. I would say, you know, I got the vaccine, and that's certainly what I experienced. It's a lot like a tetanus shot. You know, and
oh, so you've gotten the vaccine already?
I got the first dose. I still have to get the second, but I got
Okay.
the first. Yeah.
Good.
And you know, and in the trial, so not only did the vaccines appear to be really safe, they really made an effort to include people who were at increased risk for COVID. So that included people who were HIV positive as well. So people who were HIV positive were included in the trials. They appeared to do just as well as other folks. And so we're really encouraging everyone to get the vaccine for that reason.
Great. A little more regarding the vaccine safety. Is there anyone who shouldn't get the vaccine?
Yeah, so we're recommending that people talk to their physician if they fall into one of four categories. So if you're pregnant or breastfeeding, you should talk to your physician first. People who are pregnant and breastfeeding weren't studied in the trials, and so that's going to be a discussion you want to have with your provider. We're also recommending that if you're undergoing chemotherapy for cancer, if you've had an organ transplant, that you talk to your doctor. It may be that you will want to defer vaccination initially, or it may be appropriate for you to go ahead and get vaccinated depending on your specific situation. And then finally, if you've had a history of a severe allergic reaction, it's probably wise to talk to your physician first. We know that although in the initial trials, they studied over 70,000 individuals, and they didn't have any severe allergic reactions to the vaccines, but I'm sure everyone's heard that there have been cases of anaphylaxis after receiving the vaccine now that it's been given to millions of people. It's still extremely rare. I think, 20 cases and millions of doses have been given at this point.
Yeah.
But it's certainly something to discuss with your provider if you have that type of history with a history of anaphylaxis.
Gotcha. And so I've had conversation with friends and viewers, and a lot of people are concerned about the pace of the distribution of the vaccine. Why is it taking it so long to get the vaccine out? More than we expected.
Yeah, I think there are multiple reasons, and probably each state and jurisdiction has their own specific reasons as well. But I think one of the things we can certainly point to is a lack of kind of federal coordination of distribution, so that states have really in districts like the District of Columbia have been left to their own to figure out how to distribute the vaccine. States and jurisdictions weren't given resources for distribution, and so everyone's trying to figure it out as they go. And I think a lot of states didn't know exactly when or how much vaccine they were getting till almost it was ready to show up on their doorstep. So there was very little time to plan that distribution for the states, and that's caused a lot of problems. I think we certainly are going to get better at distributing the vaccine as time goes on. It's important to remember that the vaccine also first became available right around the holidays, a week or two before the holidays. So I think, we have healthcare organizations that are already stretched extremely thin, dealing with a spike in COVID cases, and now looking for personnel to give the vaccine when people are scheduled out on vacation for the holidays already. That's going to slow things down. And then, the other concern is also about how the vaccine is being distributed. I think certainly healthcare workers were recommended to be first in line for the vaccine. That happened in many states. There have also been reports of vaccine being wasted because they didn't have enough healthcare workers show up for appointments. And so there's an argument to be made about increasing the speed at which more people can gain access to the vaccine. And I think you're seeing that happen in DC and in Virginia this week with, people who are over 65 in DC were able to register this week, and 75 and over are able to register in Virginia now. So even, not waiting until every healthcare worker has received the vaccine, but kind of allowing more people to get, because I think there is pent-up demand for the vaccine. And so the more vaccines we can get into the more arms, the sooner we'll see the end of that.
Gotcha. And we got one question from a viewer. This person asked, should an HIV positive person get the vaccine if they had COVID late last summer?
So the recommendation is that people who have had COVID get the vaccine. We certainly think you do gain some immunity from COVID after having it, but there is concern that that immunity wanes, particularly after 6 months. So the recommendation is that people still get the vaccine even if they've had COVID. And that applies to anyone, whether they're HIV positive or negative.
Gotcha. All right. And so who has gotten the vaccine so far, and when can, different groups get the vaccine?
So in DC, healthcare personnel and residents of and staff of long-term care facilities have gotten the vaccine in the first line, and now the vaccine has been opened up to people who are 65 and older. In Virginia, it's also mostly been healthcare personnel, but also other frontline workers, including grocery store workers, public transit workers, teachers have been able to receive the vaccine, and they've now opened it up to 75 and older. But we're still certainly in the early phases of vaccine distribution in terms of who is eligible to receive the vaccine at this point.
Got it. And I guess when the vaccine is available, let's say it's available to me, how do I sign up? Is there a form or some type of mechanism to organize all that?
Yeah, that organization is coming. So, and some of it's here. So I think certainly as the vaccine becomes more widely available, we'll see access open up. But right now, each state is a little bit different. So DC has a website called vaccinate.dc.gov. And if you go to that website, you can sign up for text notifications and emails that will allow you to know when more vaccine becomes available and who is available to get it. You can also call 311, or they have another hotline number, 855-363-0333, to register for the vaccine if you're over 65. Virginia also has a website and a hotline. Maryland has a website and a hotline as well, and perhaps we can post that information to the group. It does depend what state you're in, so looking, Googling your state resources is going to be important early on to figure out where to access vaccine and how to know what's going on.
Yeah, I actually saw recently that California was going to begin rolling out vaccines outside of just healthcare workers in the next month. And so they basically advise to just stay tuned, pay attention to like government resources and that information be provided.
Yeah.
But I think that's pretty standard across state to state.
Yeah, I think absolutely. Almost every state at this point.
Yeah. So will Whitman-Walker be giving out the vaccine? Will I be able to get it there? If so, who will be eligible and when and how can I get it?
Yeah, we're certainly following city guidance about who is eligible to receive the vaccine. At this time, we do not have vaccine to distribute to our own patients. We certainly hope that that will change in the next month and that we'll be able to help distribute vaccine to our patients. But we're in communication with the city every day.
Okay.
And as soon as we have vaccine and are able to distribute it, we will certainly be notifying patients and putting it up on our website.
Gotcha. And well, thanks for sharing that. I have, whether it was on the news or, through social media, I've heard that some new COVID-19 strains exist and may have entered the country. What does that actually mean for us? And will these vaccines that we currently have approved, will they prevent against those new strains?
Yeah, so viruses mutate all the time. So, this is unfortunate that there's a new strain, but it's certainly not unexpected in any way. The new strain is concerning. It was first identified in the United Kingdom, and it's concerning because it appears to be more infectious. So it appears that it can attach more easily. Those spike proteins that attach to the mucosal membranes and infect people appear to be stickier and they attach better. Great for the virus, not so great for us. But the good news is, from what we know, those mutations that, although they did affect the spike protein, and both the vaccines are targeted against the spike protein, it doesn't seem that those changes should affect the efficacy of the vaccine. So at this point, the data we have seems to indicate the vaccines will still be effective. But I think it's really important to recognize that because of this new variant, which I think we can assume is widespread in the United States at this time, the importance of masking and social distancing is it's doubly important. So, you know, I think we want to make sure that we're practicing all those mitigation factors, because, you know, we're in the midst of a spike in cases. We're all indoors more, and now we have a virus that can spread even more easily. So I think, you know, that is an uphill battle.
Yeah. Well, thank you, Dr. Henn, for joining. Do you have any closing statements that you want to make? Those are all the questions that I have. And I didn't see any additional questions in the comments. So if you do have questions.
Yeah, I would just say that, you know, I would really encourage people to get the vaccine when it becomes available to them. I think these studies were done in a very inclusive way to make sure that they included people of, you know, with a variety of comorbidities, diabetes, hypertension, cardiovascular disease, but also people of different ethnicities, different genders, Black and brown people. So I think we have good evidence that this vaccine is safe and effective, really for the vast majority of Americans. So please, when you have the chance, get it. And if you're nervous about it, talk to someone else who has it, and ask questions, because I think the more you learn, the more confident you'll be able to feel in moving forward.
Got it. Yeah, I missed a question. So actually in DC, you know, residents that have chronic medical conditions, they can start getting the vaccine on February 1st. Are HIV positive people actually included in that group? So included in the chronic medical conditions. Is that true?
I think they will be. I haven't, you know, the DC website has you kind of self-attest to your category when you sign up for the vaccine. And I suspect, you know, I haven't seen what modifications they'll make when they open up the vaccine to the chronic conditions, but I suspect it will be a similar attestation that you have a chronic condition. And so I think people with HIV will fall into that category.
Yeah. All right. And we have another question that just came in. And if you have more questions, feel free. We have Dr. Henn here who can answer as many as possible. But they said, can you talk about antibodies? What does that exactly mean? You know, is it, so for example, I'm going to just spitball. I assume what this person means is, you know, if you've already, you know, had COVID, and the antibodies that you, I guess, would have after that particular exposure, and then the antibodies from the vaccine. Are there a difference, you know? Are there different levels or good levels of antibodies? Do we know the answer to that question?
Yeah, antibodies will wane over time. So people do make antibodies to the SARS-CoV-2 virus after being infected, and those antibodies appear to wane over time. So particularly early on in the pandemic, you know, there was a lot of interest in people who had had a viral illness, but perhaps hadn't had access to COVID testing, to get testing to figure out, had I had COVID or not? I think as we move forward with vaccines, that will become less relevant, because we're going to want people to get the vaccine whether or not they have antibodies for COVID. So we're going to be recommending vaccine for everyone.
Okay. Well, I hope that answered your question. If not, feel free to follow on in the comments. But yeah, I do want to thank Dr. Henn for being here today. It's always a pleasure to speak with you. Oh, we have another question. This is great. What would you say to someone who is concerned about side effects of the COVID vaccine?
I think really talking through what specific side effects they're concerned about, how they're concerned the vaccine is going to affect them, what past experiences they may have that make them concerned is important in kind of talking to people about talking to others about the vaccine. You know, those conversations are going to be different depending on those answers. But really understanding someone's concerns so that not only that they have an opportunity to voice them, but you can address them specifically is really important. There is data out there about a lot of those side effects and what percentage of people have experienced X side effect. And for some people, they want that detailed information, and having that information is a comfort for them. For other people, they want to know how friends and family reacted to the vaccine. And if they know people who took it and did well, that helps them feel reassured that they can go on and get it themselves. So everyone's going to need something, a different information to get to the point where they feel comfortable. So it's important just to kind of have those open conversations.
Yeah, and I actually agree with that. I have a few friends who got their first round this week, and I mean, I bombarded them with questions. So if you know of anybody who received the vaccine, someone that you trust, feel free to have that open conversation. I've been doing it as well. And then we have another question. Is it true that one doesn't develop immunity to COVID-19 until 10 days post second dose? Is that true?
So people are thought to develop full immunity 10 days after the second dose. Now, certainly you develop some partial immunity before that. But that being said, I will tell you, I know of two physicians who have gotten COVID in the last 2 weeks, a week after they got the vaccine. So the first dose, after the first dose of the vaccine. So the first dose isn't fully protective by any means. And certainly during you're starting to develop some immunity, but it's not complete immunity. And even after you receive the second dose, you need to remember that these vaccines are 95% effective. So it's still going to be important to wear masks and socially distance. You could still be infected even if you've had the second dose. We know that you're much less likely to get severe illness. People were much less likely to be hospitalized if they'd had the vaccine. So that's really important and reassuring. But a lot of what we're doing in terms of mitigation, masking, and social distancing, those things we're going to continue to need them even after we've received the vaccine. Start to see the epidemic wane in the United States. So when we start to really see few infections in the United States, that's when we're really going to be able to go back to normal. And that's going to require a large percentage of the population being vaccinated.
Gotcha. All right. Thanks, Dr. Henn. I have a couple more questions. So how will it affect people born with heart disease? Are there any, do we know of any side effects that the drug or has been mentioned about the vaccine in relation to heart disease?
Yeah, obviously I can't speak about a specific condition, but in general, if you have heart disease like coronary disease, that puts you at increased risk of severe disease from COVID, and people with coronary artery disease were absolutely included in the trial and did well with the vaccine. So having heart disease in general shouldn't prevent you from getting the vaccine, and it shouldn't inhibit your immune response or your to the vaccine. So for most people with heart disease, it's going to be critically important that they get the vaccine.
All right, thank you. And then we have, why does it normally take so long to get drugs approved in the U.S.?
Yeah, so I mean, this is a great question, and I think one of the things that has made people nervous about the vaccines is how quickly they were developed, and the contrast to the regular process in developing drugs. I think drugs, go through several phases of trials to be developed, and then they have to go before the FDA, and usually you have to get on the wait 6 months, and then you get you have a full evaluation, you get approved. And so it's a much slower process. And the process for these vaccines was, although none of those steps were skipped, but it was really pushed along for a couple reasons. One, these vaccines built off existing technology that had been developed and was being studied for other viruses. So even though these vaccines are the first mRNA vaccine of their kind to be distributed in the United States, there were other vaccines that had been developed using the same technology. So in some sense, we were ready to develop these vaccines. And then the other reason we were able to so quickly get these vaccines authorized is that the rate of infection around the world is so high right now. We were able to quickly enroll participants into the studies and quickly see the difference between those who got the placebo and those who got the infection, because there was so much infection going around. And so that allowed us to get phase 3 trial results rather rapidly with these vaccines. And then finally, because of the urgency of the situation, the FDA reviewed the data immediately, received it in May, and came to a decision, issued an emergency use authorization for both vaccines, in short time. And so that's why this was able to go so much more quickly than the normal drug development process.
Gotcha. Well, thanks for that information. I actually have a question from you for myself, because I've been wondering. So once a person has received the second dose of the vaccine, do you have any recommendations for safety practices, or like, should they continue the same, safety practices that we've discussed, like 6 feet apart, all that stuff? Or, what is the recommendation there?
The recommendation is going to be for continuing those same practices of distancing and masking in public spaces. I think if you are with others who you also know have been vaccinated, that, and you're in within your family or friend group, then, you could probably start to slowly widen your social circle, but you're going to need to assume for a while that others are still vulnerable to infection. And one of the things we don't know yet about the vaccines is, although we know they protect people from getting sick, we don't know that they absolutely protect people from being asymptomatically infected. So it's possible that you might be protected having had the vaccine, and you may be asymptomatic, but you could still possibly spread the infection to someone else. And that's something we're hoping to learn more now. And I know this is something that both Pfizer and Moderna are looking at, is, are people developing asymptomatic infections who are vaccinated? And we don't know the answer to that question yet.
Gotcha. All right. Well, are there any more questions? I'll leave a little bit of time there as I give a few announcements. And if you have any questions, please drop them in the comments. I do want to remind you all that Whitman-Walker is still open for free HIV and STI testing. That is by appointment at our Liz location, as well as our Max Robertson Center location. So our Liz location is in Northwest DC. Our Max Robertson Center location is in Southeast DC. To make an appointment, you can call 202-797-4439. I also want to remind you all that social distancing is still the best way to reduce the amount of COVID-19 transmission. So that means deliberately increasing your physical space between people can help avoid spreading the illness, especially around times like this when we have talks about gatherings and inaugurations and all that stuff that is happening. Make sure that you continue to stay at least 6 feet apart, wear a mask in public, avoid places with large crowds, please. If you are able to work from home, continue to do so. Also, speak with your loved ones, your family members via FaceTime, Zoom, and all that stuff. Try to avoid the in-person contact. Again, the numbers are still growing here, so we want to be mindful of that. Also, social distancing is a part of caring for your community. So if you care about your community, let's make sure we continue to social distance. Continue to wash your hands. Stay up to date on local, state, and national guidelines for testing, quarantining, and just general safety. And please stay at home if you don't feel well. I didn't see any more questions that are worth acknowledging. And so I want to remind you all to follow us on Twitter, Facebook, and Instagram at Whitman-Walker. You can also follow us at Real Talk DC _. Thanks again, Dr. Henn. I really appreciate your time.
Thank you, Dave. Have a great night.
You too. Bye-bye.
Bye-bye.
All right. I'm blocking John Perry after today. He is a troll. But thanks for joining.